here, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and this YouTube channel, Health and Horsepower. Well, I wanted to today talk a little bit more about prostate health, but also if you are suffering with symptoms of prostate inflammation or potentially even BPH or benign prostate hypertrophy, I want to talk a little bit more about some factors that you may not have told about by your doctor, or some things that you can do yourself to help manage symptoms or potentially get inflammation down enough that you don't need to rely on medication. So the first and most important thing is looking at the anatomy. So I'm going to go over the anatomy in just a second. Okay, so I wanted to start by going over the male anatomy. So if we look here, this is the bladder, and this light pink structure here that goes around your urethra, that's actually a view of the prostate. So anytime we have inflammation or any type of swelling, or if that has enlarged due to BPH or other prostate conditions, what happens is that can actually press and squeeze and close that little urethra there and cause issues not only with flow, but also with pain as well. I also have a different view that I think helps to kind of open it up a little bit more. So here's a view kind of looking internally. So again, here's the bladder. We have the urethra here going out, and right around that we have the prostate. So this kind of light pink structure there. So again, if that structure swells or gets any inflammation in it, it can not only squeeze and close that down to cause issues with urination, it can also cause pain or slow flow, and it can also affect just overall discomfort in that area because that's going to press against the other structures in that area. So it's pretty interesting to know that when we have inflammation, it's not only going to cause issues with the bladder, but it can also affect other muscle structures and function of those other structures in that area as well. The next thing that we also want to look at is inflammation factors. So when you have inflammation in the prostate, like I mentioned in that anatomy section, when you have enlargement, that's going to cause issues where it is pinching down on the urethra and causing issues with flow and also pressing against other structures that can cause some discomfort. So when it comes to inflammation, there's a lot of different factors that can cause inflammation for the prostate. One of the biggest ones is if you're putting pressure on that. So if you do a lot of sitting, or especially if you're sitting on softer or harder surfaces, what can happen is by sitting, you're actually putting pressure on the scrotum into the prostate, causing compression that can actually cause some inflammation and irritation of that. So if you tend to sit for long periods throughout the day, it might be a good idea to look into a standing workstation or maybe a workstation that can transform so you're not constantly sitting all day long. If you're sitting as a result of your job and you're constantly there, you may want to consider looking into a donut style pillow, or potentially even a cushion that'll help so you're not putting direct pressure on that area and letting your scrotum hang free. The other thing is when it comes to inflammation, we can also have inflammation in our body from other health conditions. So digestive issues, health concerns, especially if you have conditions like diabetes or if you have any type of autoimmune conditions that can cause inflammation levels to be higher. Also, if you have digestive issues, that can also cause inflammation levels to be higher. If you have food sensitivities or if your body is reacting to certain types of foods, that can also cause inflammation in your intestinal system that can contribute to overall inflammation in your body. Another thing I see a lot of times when it comes to prostate inflammation is also toxins that could be building up in your body. Anytime that our body has toxins stored in it, or if our liver and our body is having trouble getting rid of those, your body is going to tend to have higher levels of inflammation as we're dealing with that. If you have any issues with heart issues or digestive issues, like I mentioned, all those things can cause inflammation to be a factor. One other one that can also be a big factor is your diet. If you have a poor diet that is high in sugar or high in fat, not really great on the minerals, that can also cause issues where your body tends to, just because of that dietary change, have higher levels of inflammation. If you have a sedentary lifestyle where you're not doing a lot of exercise, you're not walking a lot, or potentially if you're not getting good sleep, that can also increase inflammation levels. So really the biggest thing is we need to fight inflammation. So trying to remove pressures, remove stressors, remove any inflammation in our body that could be irritating that as well. If you tend to have more of the food sensitivities, I definitely recommend getting those tested to find out what foods are causing more inflammation and what foods you should swap those out for that aren't causing issues for you as well. One of the biggest things is when we also look at nutritional deficiencies, or when we look at inflammation in our intestine systems, or potentially diet, we can also have some nutrients that are deficient that can also lead to some hypertrophy or swelling of the prostate. One of those things that we see a lot in the research is deficiency of zinc. Zinc is actually one of the minerals that your body needs to make a lot of your hormones and help with transitioning, help with inflammation, help with immune function. So if your body is deficient in zinc due to poor diet or possibly poor absorption, that may also be an issue. I typically recommend for most people to get around 30 milligrams of zinc per day. That's a combination of with your food sources, multivitamin, and sometimes even additional minerals as well. Another one we can see deficiencies with is vitamin C. So vitamin C, we do need to make sure we have a good form. We want a buffered form of vitamin C that is not sourced synthetically in a lab from corn, because when you are sourcing synthetic corn from a lab, a lot of times we're having more of that synthetic actually causes more inflammation. So you do want to make sure you have a high quality vitamin C. A lot of times if it's labeled as ascorbic acid on the label, you may need to look a little bit deeper to see what that ascorbic acid was made from. As if it's synthetic in a lab, that's not the one you want. You want to look for more of a buffered source, or potentially even just looking at eating foods that are rich in vitamin C. I usually recommend a bare minimum of 1,000 milligrams of vitamin C per day. You do need to make sure you have plenty of water, and I usually recommend splitting that in 2 doses so you don't have any digestive issues by taking a large amount at once. And the other mineral that tends to be deficient and has been linked with prostate inflammation and prostate hypertrophy is vitamin D deficiency. So if your body does not have enough vitamin D, which vitamin D is not just a vitamin, it actually acts as a hormone in the body. It helps with immune function. It helps with many different things. So those are 3 nutrients that we tend to see a lot as deficient and are linked specifically with prostate inflammation and hypertrophy. The other thing is when you're looking at how do we support that gland and how do we prevent it from becoming inflamed, we may want to look into a supplement that actually supports not only the prostate health, but also make sure we're getting those minerals and also make sure we're keeping inflammation levels under control. We carry a product in our office. It's by Protocol for Life Balance. It's called Prostate B. So in addition to having the zinc and the vitamin D, and also some vitamin C in here, this also has saw palmetto, which actually helps to improve not only prostate health, it actually improves testosterone levels. It also has quercetin, stinging nettle, and turmeric in it, which again is anti-inflammatories that are natural sources of those. It also has pumpkin seed oil, which is a really great source of not only zinc, but also a lot of other minerals that are super great for prostate health. So something like that would be something you could take on a regular basis to just support the prostate and also try to make sure you're getting enough of those minerals. I did already mention testosterone. So some of the research has been, they don't really know exactly the link, but there's a couple different things that they have associated. So if our estrogen levels are high and our liver's having trouble getting rid of excess estrogen, that can cause issues with benign prostate hypertrophy. But also, if your body has some testosterone transition issues, so whether your body's having trouble converting or having enough made and enough free out there able to be unbound and doing its job, that can also be linked with prostate issues. So if you haven't had your hormones tested, not just testosterone, I usually recommend getting estradiol, which is estrogen levels tested, DHT, which is a precursor to testosterone, and then total and free testosterone. If those levels are not in the proper range, sometimes we may need to look a little bit deeper at root cause to make sure that the pituitary gland is working properly and we don't need additional herbals to support that. But in some cases, it may just be a matter of looking at diet, looking at supplements that can help get those back in range, and then trying to make sure that we're supporting your body so it can produce this on its own and we're not stuck on medications and we're not stuck with injections for long term. But if you need some more help or you're wanting to just get some guidance in this, you can definitely give my office a call. Our phone number is 309-689-6200, or you can go on our website, freedompeoria.org, and request an appointment as well.